Hello! This might sound a bit strange, but in reality, most blood pressure readings taken at a doctor's clinic are often not entirely accurate. And this isn't usually the staff's fault. It's just that the clinic environment itself makes it difficult to get a true reading. This is very important because many people are mistakenly told they have high blood pressure when it's actually normal, and sometimes normal readings can miss real hypertension. In other words, either people end up taking unnecessary medication or the real problem goes unnoticed. That's why it's crucial for everyone to know how to measure their blood pressure accurately at home. Mistake number 1, measuring blood pressure with a full bladder. The first and most common mistake people make when checking their blood pressure is doing it with a full bladder. When your bladder is full, your sympathetic nervous system, the fight-or-flight system, gets activated. This causes your heart to beat faster, your blood vessels to constrict, and naturally, your blood pressure rises. If you want to know your true blood pressure, it's essential to measure it in a relaxed, calm environment after emptying your bladder. This small tip can be a real game changer in preventing misleading readings. Research shows that measuring blood pressure with a full bladder can raise systolic pressure by 4 to 33 mmHg and diastolic pressure by 3 near 18 mmHg. Think about it. Just one number can sometimes determine whether you start blood pressure medication or not. That's why always emptying your bladder before measuring is crucial to get an accurate and reliable reading. Mistake number 2, using only one arm to measure blood pressure. A common mistake people make is measuring their blood pressure using only one arm and forgetting to check both. Most medical societies actually recommend measuring both arms on the first visit because readings in the two arms are often not exactly the same. A small difference between your left and right arm is normal. But if your systolic blood pressure, the top number, differs by more than 10 mmHg, that's a warning sign. And you should see a doctor to make sure there's no narrowing or other problem in your blood vessels. In practical terms, you don't need to measure both arms every time, but checking both at least once and then using the arm with the higher reading for future measurements gives the most accurate and reliable information. Mistake number 3, not sitting properly while measuring blood pressure. A common mistake people make when measuring blood pressure is not sitting properly. For an accurate reading, your feet should be flat on the floor, legs uncrossed, and you should sit in a chair that supports your back. Without proper back support, systolic blood pressure can be 5-15 mmHg higher. It's also important to stay relaxed, breathe normally, and keep your arm calm to avoid artificially high readings. If posture isn't maintained correctly, not only can readings be inaccurate, but it can also lead to unnecessary stress and misdiagnosis. That's why maintaining proper posture every time you measure your blood pressure is essential. Mistake number 3, not sitting properly while measuring blood pressure. A common mistake people make when measuring blood pressure is not sitting properly. For an accurate reading, your feet should be flat on the floor, legs uncrossed, and you should sit in a chair that supports your back. Without proper back support, systolic blood pressure can be 5-15 mmHg higher. It's also important to stay relaxed, breathe normally, and keep your arm calm to avoid artificially high readings. If posture isn't maintained correctly, not only can readings be inaccurate, but it can also lead to unnecessary stress and misdiagnosis. That's why maintaining proper posture every time you measure your blood pressure is essential. Mistake number 5, relying on only 1 or 2 readings. A common mistake people make is deciding whether their blood pressure is normal or high based on just 1 or 2 readings. Blood pressure is not a fixed number. It naturally goes up and down throughout the day, depending on stress, sleep, physical activity, diet, and even breathing patterns. Because of this, a single high or normal reading does not tell the full story. The best approach is to measure your blood pressure daily for the first 2 weeks. And take 2 readings each time, ideally from different arms with at least 1 minute between measurements. While this may seem inconvenient at first, those 2 weeks provide a true baseline and reveal your real trend. After that, if there is a risk of high blood pressure, measuring 2 to 3 times per week is usually sufficient, with the frequency adjusted based on your needs and progress. If your blood pressure is normal, checking it once every 1 to 2 weeks is generally enough. This method helps you understand real averages and patterns instead of relying on just 1 or 2 misleading numbers. Mistake number 6, using wrist monitors instead of upper arm cuffs. Another common mistake is relying on wrist blood pressure monitors instead of upper arm cuffs, which are generally considered more accurate and reliable. While some wrist devices have been validated in controlled settings, they come with important limitations. The biggest issue is proper positioning, placing the sensor exactly over the radial artery. And keeping the wrist at heart level is difficult for most people. Because of this, everyday readings are often inaccurate. In one population-based study involving more than 700 people, at least a 5 mm Chagrag error was seen in 86% of participants, and errors of up to 10 mm were found in 63%. For this reason, wrist monitors should only be used when an upper arm cuff is not possible. If wrist readings are consistently high, it's important to consult a doctor to confirm your true blood pressure with a more reliable method. Mistake number 7, not relaxing before measurement. A common mistake people make is measuring their blood pressure without first allowing themselves to relax. If you've been walking, exercising, or are feeling stressed, your nervous system remains activated, and your heart rate stays elevated, which can artificially raise your blood pressure readings. That's why it's essential to sit quietly and relax for at least 5 minutes before measuring, with your back supported and your feet flat on the floor. Avoid using your phone or engaging in conversation, and breathe normally so your body can fully settle. Taking this short pause helps ensure that your reading reflects your true and accurate blood pressure, rather than a temporary stress response. Mistake number 8, consuming caffeine or alcohol before measurement. Another common mistake is consuming tea, coffee, or alcohol before measuring blood pressure. Both caffeine and alcohol can temporarily raise or lower blood pressure, leading to inaccurate readings. In general, it's recommended to avoid caffeine for at least 30 minutes before checking your blood pressure. Alcohol has a longer-lasting effect. If you've consumed alcohol within the past 24 hours, your reading may not be reliable. Understanding this is important so that your measurement reflects your true blood pressure rather than a temporary effect from what you've consumed. Mistake number 9, using incorrect cuff size. A common mistake people make when measuring blood pressure is using the wrong cuff size. If the cuff is too small, it applies excessive pressure and can falsely raise the reading, while a cuff that is too large may produce readings that are inaccurately low. That's why it's essential to use a cuff size that matches your arm. The cuff should always be placed on bare skin. Do not roll tight sleeves up over the arm. And ideally, the bladder length should cover 75 to 100% of the arm's circumference, with a width of about 40–50%. Paying attention to these details helps ensure accurate and reliable blood pressure measurements. Mistake number 10, not following a consistent measurement schedule. A common mistake people make is judging their blood pressure status based on just 1 or 2 readings. Blood pressure naturally fluctuates throughout the day, depending on stress levels, sleep quality, physical activity, and diet. So, a single or even a couple of readings do not tell the full story. A better approach is to take multiple readings daily for the first 2 weeks, ideally from both arms, with at least 1 minute between measurements. This initial period helps establish a true baseline. After that, if there is a risk of high blood pressure, measuring 2 to 3 times per week is usually sufficient, with the frequency adjusted based on individual needs and progress. This method helps you understand real averages and long-term trends instead of relying on isolated numbers. Measuring blood pressure correctly is not just about numbers. It's about getting a true picture of your overall health. Many people believe that blood pressure readings taken at a doctor's clinic are always the most reliable. But in reality, the clinic environment, staff activity, and patient anxiety can artificially raise or lower readings. That's why measuring blood pressure correctly at home is so important. Paying attention to small details such as a calm environment, proper posture, checking both arms initially, using the correct cuff size, and taking repeated readings helps reveal your true trend and average blood pressure. This approach not only helps detect high or low blood pressure, but also allows you to see how lifestyle factors like diet, exercise, sleep, and stress management affect your numbers over time. By following these steps, you can avoid unnecessary medications, while also catching true hypertension early and managing it more effectively. Blood pressure monitoring should be a regular part of your daily routine. The more consistent and accurate it is, the more beneficial it will be for your long-term health. By correcting these common mistakes, you can take real control of your health. Thank you so much for visiting the channel. If you found this video helpful, please like it. And if this is your first time here, don't forget to subscribe. We'll meet again in a new video. Until then, take care of yourself. Goodbye and stay healthy.